More than 10 million people across the UK have now received at least one vaccination for coronavirus as part of the biggest programme of its kind in the history of the NHS. It's a major milestone in the race to control the faster spreading variants of the virus. Ministers are hoping to avoid yet another lockdown by protecting the most vulnerable groups. And the plan is to offer vaccines to 15 million people, those aged 70 and over, healthcare workers, people who need to shield, by mid-February. In the meantime, experts say that the number of deaths will remain significant as infection levels, they say, are still alarmingly high. Our political editor Laura Kuenssberg has the latest.
Sleeves up, syringes ready, vaccine in. Army medics filling this church hall in Chingford where there used to be bingo nights and dog training. They'd done 400 by lunchtime, no hanging about.
Obviously a lot of people are shocked that we're here, but then they're also so thankful that we're here, and it's just nice to just feel like appreciated.
They've literally come out of their house just for this vaccination, and they've literally turned around and said, look, we can't thank you enough. And I can't tell you how much that resonates with each and every one of us.
Now the whole country has hit the 10 million mark.
We have today passed the milestone of 10 million vaccinations in the United Kingdom, including almost 90% of those aged 75 and over in England.
Whether a church hall, a town hall, a temple or a car park at a leisure centre, there are more and more places right round the country where the vaccine is on offer, helping to loosen the grip the pandemic has had on our country for such a long time. But the vaccine programme, astonishing though it is not a route out on its own.
Are you sure the vaccines work on all the variants, Prime Minister?
He's accused of leaving a gap where more dangerous versions of the disease could creep in. Boris Johnson promised travellers arriving from 30 at-risk countries would have to stay in hotels at airports for 10 days. But there's no date for when that will start, and Labour wants every country on the list.
With new variants in the country, our schools are shut and our borders are open. 21,000 people are coming into this country every day. The Prime Minister's new border arrangements are still weeks away from being implemented.
This queue in a London suburb isn't for the vaccine, but extra testing to clamp down on the new variant of the disease from South Africa that's already here. And the government admitted today at least 20,000 people instructed to isolate with the disease aren't doing so. Therese came out for the first time for many months for her vaccine, but understands why others might break the rules.
There are people still going to work because they need the money. They're not doing it to deliberately say, I don't care.
And in lockdown, 28-year-old Nish has become the breadwinner, but he reckons it's hard to force people to stay at home.
I think the majority of people will not self-isolate because of lockdown fatigue, and also I'd say not clear messaging from the government.
Was it clear today?
Can you give a firm date for when hotel quarantine will start, and will you offer more help for people who just can't afford to isolate? If not, aren't you leaving two big holes in our defences?
We have among the toughest border regimes now anywhere in the world. We're restricting as much as we can any risk of importing new infection into this country without totally secluding the UK economy. But NHS Test and Trace is reaching 90% of contacts, and the vast majority of them are doing the right thing.
The Prime Minister did confirm he wants England at least to leave lockdown as one, even if the rest of the UK might follow different timetables. But while there's jubilation at the vaccine, there are still obstacles ahead. It's too early to take a break. Laura Kuenssberg, BBC News.
Now, the pharma giant AstraZeneca and Oxford University say they plan to have a next-generation COVID vaccine ready for the autumn. The new jab will help to give people protection against some of the latest variants discovered recently. The Health Secretary, Matt Hancock, said the latest research indicating that the Oxford AstraZeneca vaccine might reduce the spread of the virus was superb news. Our medical editor, Fergus Walsh, has more details.
The scientists at Oxford who created the AstraZeneca vaccine are continually monitoring how coronavirus is evolving. The current vaccine is thought to give good protection against new variants, but they're working on tweaking the jab to make it future-proof. The scientist who's leading the research says it's relatively simple to redesign the vaccine.
It's not difficult to put a different antigenic insert into the vaccine. So we don't want to panic and say that we must have a new version of the vaccine now. But on the other hand, we are getting prepared so that if it turns out we do need a new version, it will be ready to start using it.
So it's just going to be a sharp scratch, okay?
Those on the Oxford vaccine trials were shown to have 76% protection from a single dose, which lasted 3 months, rising to 82% protection with the second shot.
You'll be doing swabs every week at home.
It's also the first time a COVID vaccine has been shown to reduce transmission of coronavirus. Those immunised were much less likely to test positive for infection, cutting the risk of them passing the virus on to others. That's the vaccine, but what about those who've actually had COVID? They want to know how long they may be protected against subsequent infection. A study involving nearly 20,000 volunteers may provide at least part of the answer. Like the other participants, I was asked to send off a few drops of my blood every month to a lab. Scientists at UK Biobank found that 88% of participants, nearly 9 in 10, who started off with antibodies, still had them 6 months later.
I think these findings are really good news because it does suggest that people who have been infected with the virus may have some degree of protection against another infection for some considerable time. And I think what we'd really like to know next is how long does this natural immunity last for beyond 6 months?
Scientists think vaccines are likely to offer much stronger protection than natural infection. So a key message is to get immunised, even if you've already had COVID, to boost your immunity and maybe protect others. Fergus Walsh, BBC News.
So let's take a look then at the latest official figures. They show a continuing fall in new cases of coronavirus. There were 19,202 new infections recorded in the latest 24-hour period, which means that on average, the number of new cases reported per day in the past week is 22,396. Across the UK, an average of 32,851 people were in hospital with coronavirus over the 7 days to Monday, including suspected cases in Wales. 1,322 deaths were reported, that's people who died within 28 days of a positive COVID test. And on average in the past week, 1,064 deaths were announced every day. The total number of deaths so far across the UK is 109,335. And let's look at the vaccination rollout now then. Just these figures, 374,756 people have had their first dose of one of the 3 approved vaccines in the latest 24-hour period. And as we've heard, that takes the overall number of people who've had their first jab to 10,021,471. Let's have a word tonight again with our health editor, Hugh Pym. Lots of people looking at these very impressive vaccination figures, Hugh, and then wondering, well, does that mean there's a change of calculation around when lockdown might be eased?
Well, Hugh, there was certainly a more optimistic tone to this media briefing than some we've seen in recent weeks. The Prime Minister talked about signs of hope, although infection levels, he said, were very high. And Professor Chris Whitty, the UK government's chief medical advisor, went further than before to say we were past the peak of this recent surge. He said all the key numbers on the graphs were coming down. That's case numbers, numbers in hospitals and deaths. So the questions were being asked at the briefing, what did this mean for restrictions? But the Prime Minister was sticking very much to his previous line, which is that you need to get all the key priority groups, the top 4 groups, 70s and over, vaccinated by the middle of this month, and then wait 3 weeks till full immunity had been built up, or as much as possible, to be absolutely certain. And only then, on March the 8th, to open up schools in England and possibly consider other restrictions being eased as well. And that's even though Scotland's indicated it'll start opening up schools later this month, and the Welsh Government is considering it as well. So sticking to that pretty cautious line. And one clue was given by Chris Whitty when asked why this was being adopted, this sort of line. He said, with all these variants, it only takes cases to go up a bit for the NHS to get into trouble very quickly again.
Hugh, many thanks once again. Hugh Pym, our health editor there.